So I'm repeating this thing for all the students who have joined the course, that please come in the live session after reading the theory. After reading the theory, if you are coming and joining the 30th September live session without reading all the topics I have provided in the group, I'm very much afraid that you won't be able to, solve the questions with your background knowledge, and that won't be a productive kind of session for you. So keep this thing in mind, okay? Now, dears, let's start. The first thing I keep telling you that make the concepts, make the concepts, make the concepts. For everything, you need concepts to learn, no matter how difficult the topic is. If you make concepts, you can ace the topic very easily. So here, first concept, we will work on the concepts in this session, and we will be very quick so that you revise the thing from your notes and you can hear my voice in your ears when you're revising from the notes, and that's all you need. Okay, perineum is not difficult. It just requires some basic background knowledge and some steps you need to follow. So firstly, we have to understand that we have this abdominal cavity, then we have pelvic cavity and the perineum. Okay, this is basin-like cavity is the pelvis, and below the pelvis we have perineum. And guys, perineum is the smallest and a very little area in the body. You can see here, this pelvic diaphragm, you need to understand this point. First, this pelvic diaphragm is separating these two cavities. Okay. Now, Dr. Sana will tell me what is this pelvic diaphragm is made up of. You can see this is like a curtain. This is like a boundary between the pelvis and the perineum. So what this boundary is made up of?
Uh, it it is composed of levator and eye muscle and
Yes. Who wants to tell
and
me this? Guys, pelvic diaphragm is made up of which muscles? I want you to contribute so that you can learn easily. Yes.
Levator and coccygeus muscle.
Use the chat box. Okay, it was a very long pause. I started thinking that if my voice is audible for the students or not. Okay, great. Levator and iron coccygeus, these are the two muscles which are making up this curtain, which is between the two cavities. And we need to consider that if we consider these two cavities like two rooms, above we have pelvis and below we have perineum. And we say that there is a wall, we call the wall pelvic diaphragm or the pelvic floor. Then if it is floor to the pelvic cavity, can it be the roof to the perineum? Yes or no? The same structure is the roof for the perineum and floor for the pelvic cavity, right? Yes. So this is one concept you have made, and here you have to learn that urogenital diaphragm. You know, the word diaphragm is same for both the things, the pelvic diaphragm and urogenital diaphragm, but these two are two different things. Okay, these two are two different things. Now, guys, consider this thing that perineum is a very small area located just below the pelvis and between both thighs. So this diamond shaped area in the female body, we call it as, yes, urogenital diaphragm is an inside structure, and pelvic diaphragm is the structure which is differentiating the two cavities. So this diamond-shaped area is actually called the perineum. So here I want you to remember this thing, and if you understand this thing today, you will never forget this concept, and this is all you need for understanding the perineum. So firstly, we have decided that it is very small, but this is a complicated one. Perineum is small, but it is a complicated compartment of the body. Why this is complicated? Because it has some spaces, and it has some pouches, and it has some layers of the muscles. So if we, unlock these mysteries, that what this perineum is made up of, it will be an easy compartment for us. For that, we have to follow some small steps. So first step is to identify the boundaries of the perineum. You know where the perineum is. So firstly, you will look at this and you will start thinking that how about making two triangles out of this thing we are calling as perineum. Then by using your anatomy knowledge, you will call it anterior triangle, and you will call this one posterior triangle. Okay, this is all your imagination. This is all your imagination. You are drawing these triangles for your own ease. You are facilitating yourself for this thing, that you are following small steps to understand a complicated space, a complicated little space in the human body. So this is your anterior triangle, this is your posterior triangle. Now, if you look closely, guys, you have anus in your posterior triangle, which is an opening, and you have, because we're talking about the female only, you have urethral and vaginal opening on the anterior side. Okay, so by using this very basic knowledge of the anatomy, you call this one anal triangle, posterior one is the anal triangle, and anterior one, again by using the name of these two, you will call it urogenital triangle. Okay, uro coming from the opening of the urethra, and genital is coming from the opening of the vagina. That's all. After making these two triangles, you have to learn that this boundary line, which is differentiating between these two triangles, how it's made, what are the corners called, and from where it is running. So tell me, anterior and posterior triangle, guys, is this I'm showing you the next slide. Is this true, or you have any knowledge about it, that both of the triangles, the line which is joining them is passing from one ischial tuberosity to the other ischial tuberosity on both of the sides, on the lateral sides, and this is the perineal body. This is the perineal body, right? If you have this knowledge, then it's very easy for you to understand the rest of the thing. But if you don't have this knowledge, then it's a point to add in your memory, that the line joining these two points, the both on the lateral sides we have ischial tuberosities, and in the middle we have uh, perineal body between urogenital and anal triangles. So I have given the boundaries. You will read the notes and you will learn the boundaries, and they will not give you a question in the exam. Like I want to tell this thing to you, that they will not give you a question like Dr. Anjum, Dr. Delishpa, Dr. Dr. Ash, Dr. Bushra, all of you should be very attentive to this point that they are not giving you short answer questions. They are not giving you, sorry, we can't say short answer questions. We should say long answer questions. They are not saying that write down all the boundaries of the perineum. It happened in our medical schools. Okay, Dr. Sadia, okay, Dr. Sahar, Dr. Sophia, Dr. Zara, Mir Alam. It should be in your mind that in post-graduation exams, they are giving you a particular structure and they don't want you to write long, long stories in the answers. They will not give you any chance to waste your time in the exam. They will only give you questions with 5 options and you have to select one and that's all. Okay. So if you aim to prepare this way, you will understand everything and you will memorize everything that way. If you keep that, medical school before the graduation kind of feeling in your heart, then you will not be able to do the smart study. I keep telling you that for the post graduation exams, guys, you have to do smart study. Now, if in this whole slide, you have learned these points that this line is crossing through the perennial body and this line is joining between ischial tuberosities, then if they ask these two questions, that's fine. But if you have learned everything and you have missed these 2 points, which are actual focus of the examiners, then you won't be able to secure a mark in the exam. Okay. So now I'm writing down the steps you are going to follow, and for that I will enter a slide here, a blank slide. Okay. So for learning the perineum, guys, remember the first thing, you made triangles. You made triangles. You learned the boundaries of the triangles. It's very difficult for me to write on the screen this way, but I'm giving you the idea of the following the steps. So just learn that how you're gonna fix this issue of the perineum. What will be the second thing? You will start learning from the interior triangle and you will learn 3 things here. What are the 3 things? You will learn the spaces or the pouches, how many pouches, how they are made, and what these pouches are containing inside. This will be your first step. Before this, guys, you have to learn about the fascia of the perineum. Because why this fascia is important to learn? Because this fascia is giving you some walls and boundaries of the pouches. This is contributing in the formation of the pouches. How? We will learn in the slides. So you made the triangles, you learned about the fascia. Automatically there are the pouches. By the fascia, you learned about the pouches. Then you learn about the contents of the pouches. Then, guys, you have to learn another thing, which is muscles group. Because why perineum is complicated? This is only complicated because we have similar names. Here we have superficial and deep pouches, and somehow the contents of the superficial and deep pouches are connected to this last step, but you have to learn that superficial and deep group of muscles differently so that you never make a mistake. Okay. What will be the third step? You will learn about the posterior triangle, and posterior triangle, guys, it's very easy. The more complicated and difficult one is the urogenital triangle. So that's all. If you follow these steps, if you follow these steps in this order, you will memorize the whole perineum in this way. And again, I'm saying that it won't be a difficult thing for you to understand, and it will be very easy to solve the question in the exam. So let's start with the boundaries. Anterior boundary. Now you will keep this diamond in the mind, this yellow diamond, or the division of the triangles in the mind. So anterior boundary is the pubic symphysis, posterior is the coccyx. And if you imagine a human being, if you imagine a human being, and you know that spinal cord is ending at the coccyx. Okay, spinal cord is ending at the coccyx. After the spinal cord, we have no bone beneath that. So coccyx is the last thing. So if we're talking about the perineum, which is the last compartment in the body, what else can be the posterior boundary? So it's obviously the coccyx. And interiorly, we have pubic symphysis and no other structure beneath this in the body. So if you imagine the human body, you can easily define the boundaries. Okay. Lateral, we have already decided that we have skill tuberosities, and they have explained in the skill tuberosities more. Anterior lateral, we have pubic rami. On posterior lateral side, we have sacrotuberous ligaments. So who will tell me that these boundaries are similar to what boundaries? Can you recall something after talking about these boundaries? Okay, I'm giving you the hint. Are these boundaries similar to pelvic inlet boundaries or pelvic outlet boundaries? Exactly, Sophia, Alishba, very good. These are similar to pelvic outlet boundaries. So if you are learning one thing, if you have learned the pelvic outlet boundaries, you have automatically learned the boundaries of the perineum also. Okay, very good. And the division you have done is given here, anterior half, posterior half, and that's all. We will not repeat this point, and we will go to the next slide. You all have this file. You all have this file, and you will keep revising before we start the 30th September session, and you will keep revising before the exam. Perineum is a small area in the body, but it's not a small topic for the exam. Pelvis and the perineum both are equally important for the exam. These two areas all actually you save yourself by reading past papers. Everybody knows that we are conducting 1 hour class of past papers every day, and today again at 9 p.m. we will do the work in that class. So that class is very important because it's giving you the idea that how MRCOG exam is different than MRCP, and how MRCOG exam is different than FCPS and from every exam in the world. So keep this thing in mind that you save yourself by reading past papers of the perineum, that how they ask the question. Are they very straight, or they go deep inside details? So you get this idea from the past papers only, but understanding a region, understanding the anatomy for your own knowledge, for being an obs-gynae doctor is very important. So keep keep these both points in the mind. Now, the first step which we decided that we will talk about the fascia. Now, guys, just like today I shared the notes for the abdomen, and you have seen that in the abdomen you have superficial and deep fascia. So just like that in the body we have superficial and deep fascia. So superficial fascia is again having two layers, a fatty one and a membranous one. The names are suggesting that fatty layer will be fatty and the membranous one will be just a membrane, but we have other names for memorizing this. Fatty layer is called as Camper's fascia and membranous layer is called as Pullis. So what we have to memorize is that fatty layer is continuous with the fatty layer of the abdominal wall. This is the most important point, and it is also forming the bulk of the labia majora and mons pubis. And guys, membranous layer, it lies deep to the fatty layer, and it is superficial membranous layer of the perineum, and it is continuous with this carpus fascia of the anterior abdominal wall. Okay, this is all about superficial layer. And now we will talk about further the deep layer. This deep perineal fascia, now this is this is the actual thing which is serving the perineal compartment. This is the actual thing. It again has these 2 points you have to remember, that the first point, that the perineal fascia, it is covering superficial group of muscles. Okay, bulbospongiosus, ischiocavernosus, and superficial transverse perineal muscles. We have deep transverse perineal muscles, we have superficial transverse perineal muscles, and the deep perineal fascia is, because it is superficial to the deep group of muscles, it will cover superficial transverse perineal muscles, bulbospongiosus, ischiocavernosus. Okay. Now, what is perineal membrane? For learning the perineal membrane, you have to look at this diagram. Look at this. Skin, then two parts of the superficial fascia, fatty layer and membranous layer. We decided that membranous layer of superficial perineal fascia is called as Pullis fascia. Then we have deep fascia, and from the deep fascia, you have this line to follow, this one. I'm drawing this line. Forget about Scarpas and Camper now. Now we have to think that where deep fascia is. Okay, this is your deep fascia. It is contributing by making structures. It is giving you perineal membrane this way, this way. Okay. So guys, the perineal membrane, it's a thick fibrous layer of the fascia that forms the inferior border of the urogenital diaphragm. I'm explaining urogenital diaphragm in the next slide. And it stretches between the two sides of the pubic arch and provides support to the pelvic floor. The external genitalia and urethra pass through this membrane. Very important point, very important point. Now again, we will go back to that thing. We decided that we will study the urogenital diaphragm first, sorry, urogenital triangle first. And this is our anterior urogenital triangle. Then we decided that it will be having two pouches. It will be having fascia. Fascia will make the pouches, and then we will have contents of the pouches. And then fourth thing was superficial and deep group of muscles. So here in this diagram, guys, look at this thing. Perineal membrane, deep perineal pouch, and superficial perineal pouch. Now, tell me, we were talking about the space occupied by the pelvic cavity and the perineal cavity, and we decided that between these two cavities, if these are acting like two rooms, then between these two cavities, the thing which will be separating these two, one for the pelvis, that will be the roof, sorry, perineum, that will be the roof, and for the pelvis, that will be the floor. The floor to the pelvis will be the roof to the perineum. We decided this thing. Now I want you to apply the same thing at these two pouches. This is the pouch number 1, this is the pouch number 2. Now guys, tell me, this is skin of the body. Which pouch will be superficial? 1 or 2? Yes. Use the chat box. One will be closer to the skin. One will be closer to the skin, so we call it superficial pouch. And anything which is deeper than the superficial, we call it deep pouch. That's all. Okay. Now, if these two are different structures, then there must be something which is separating these two. So we decided that deep layer of fascia is serving here as a curtain. So we call it perineal membrane. Now tell me, if perineal membrane is roof to the superficial pouch or the superior boundary of the superficial pouch, if I say that it is the inferior boundary of the deep pouch, it will correct or not? Yes. Okay, I'm repeating. If I'm saying that perineal membrane, which is between these two compartments, and superficial, for the superficial compartment, it is the superior boundary. So if I say for the deep compartment, it is the inferior boundary. Both the times we are talking about same thing, but compartments are different. So save my words, because these three things are three past paper questions. Okay, you have got three past paper questions. First past paper question, which structure is separating the superficial and deep compartment? You will say perineal membrane. Second past paper question, what is the inferior boundary of the deep perineal pouch? You will say perineal membrane. Third past paper question, what is the superior boundary of the superficial perineal pouch? You will say perineal membrane. That's all. If you have learned these three past paper questions, guys, then you have saved yourself. If you have got very little idea about the perineal membrane, but you have learned these three questions, you have saved yourself. Now it's time to learn what is urogenital diaphragm. What is urogenital diaphragm? Now again we will talk about that we are learning about the interior triangle. We're learning about the fascia. Fascia is giving us the pouches. Pouches have the contents, and we have superficial and deep group of muscles, and we will follow this order. But first I want you to give me the names of the superficial group of muscles and deep group of muscles. And also tell me, if we are calling them superficial and they are superficial to the deeper ones, can they be the part of the superficial pouch? And can these be the part of the deep pouch? Is this a possibility? If we are calling something a pouch, we have pouch for keeping the makeup, we have pouch for keeping the things. So that means if you're calling something a pouch, it must have contents. So superficial muscles can be the content of superficial pouch. Yes, it makes sense. It makes sense. So superficial group of muscles, mention the names. Yes, Dr. Sadia, very good. Can you mention the names of the superficial group of muscles in the perineum? We have just talked about it. I didn't focus because pelvic diaphragm is okay. Pelvic diaphragm is actually not a muscle. It's a structure. It can have muscles, but are these muscles superficial? Very good, Sophia. Bulbospongiosis is the superficial muscle. Ischiocavernosus, very good. Superficial transverse muscle. So here I want you to learn main three muscles in the superficial compartment, and I will tell you to learn two names in the deep ones. If you learn these total five, you are good. So bulbospongiosis, ischiocavernosus, and superficial deep transverse muscles. I'm showing you a picture showing all these three. Then you will understand better. But for now, learn these three names. And for the deep, if we have superficial transverse muscles, just a minute. Then we must have deep transverse muscles. Guys, it also makes sense. If we have superficial transfers, then we should have deep transfers, because something is superficial, then there is a deeper structure. So we name it this way. And the other is sphincter, sphincter of the urethra. So remember these five names, and it will cover main and major information about the muscles. Okay, so we learned superficial and deep muscles here. Now we are going to learn about urogenital diaphragm. Guys, we are going back to this deep perineal pouch information. You can see that this is the perineal membrane. This is the perineal membrane, this one, not the whole structure. This blue one is the perineal membrane. Urogenital diaphragm is just like a bread of the sandwich. Okay, this is your sandwich. It has an upper slice and it has a lower slice. Okay, you are eating this sandwich and you have filled your sandwich with the meat. Okay, you have filled your sandwich with the meat. Now, if we have called urogenital diaphragm and its content a sandwich, we will understand that what is the name of the lower slice of the bread, what is the name of the upper slice of the bread, and what we call the inside material. So inside material is the deep group of muscles. Okay, deep transverse muscles and sphincter urethrae, these two are the meaty part of the sandwich. What is the lower layer of the deep perineal pouch is called? Perineal membrane. Okay, because right below the deep pouch we have superficial pouch, and these two are separated by perineal membrane. You have this information. And what is the upper layer is called? Actually, upper layer is called nothing. It is just the upper layer of the urogenital diaphragm. That's all. Is this thing clear? That how urogenital diaphragm is made? Very good. And you have got this idea that deep pouch, this whole structure is called deep pouch. Okay, this whole structure is called deep pouch. You can see now again, this is upper layer of the urogenital diaphragm. Follow my point. This is the lower layer, and the lower layer we call as perineal membrane. And inside matter is this deep group of muscles. That's all. Remember this thing again. If you follow these 4 steps, if you follow these 4 steps for learning, if you memorize the names of these muscles, and then you remember the role of the perineal membrane, and then you remember this sandwich story, you can easily learn urogenital triangle. And now what is left? What is left? Superficial perineal pouch. Superficial perineal pouch is left. Superficial perineal pouch is right in front of our eyes. This is superficial perineal pouch. This one. And let's talk about the contents of these both pouches. You already learned the content of the deep pouch, but now we will learn about the superficial perineal pouch as well. So again, I've told you the past paper question, guys. Superficial boundary of the superior boundary of the superficial pouch. Again, the past paper question, perineal membrane. Inferior boundary is Cooley's fascia. Okay. Inferior boundary is Cooley's fascia. Laterals are the scipubic rami and posterior boundary is the perineal body. What are the contents? Bulb of the vestibule and crura of the clitoris. No matter you have to cram the contents, no matter you have to make strong concepts, remember that contents of the superficial and deep perineal pouch are very, very important. You should know the difference between male and female. We have bulbospongiosus muscle, we have scapupoinosus muscle. I will show you the picture I've told you. Then we have superficial transverse perineal muscles. All three we have memorized just in the previous slide. Then we have Bartholin gland in the superficial perineal pouch, and branches of the internal pudendal vessels and the pudendal nerve is also present here. Okay, let's move to the contents of the deep pouch. Now we will start from the inferior boundary. Inferior boundary is the perineal membrane, just like we talked about the superior boundary of the superficial pouch, that was the perineal membrane. But the superior boundary is the pelvic diaphragm. Okay, lateral, inferior part of the obturator fascia and the scipubic rami. Anteriorly, we have pubic symphysis. Posterior is again the perineal body. Contents, deep transverse perineal muscles. I told you. Okay, superficial transverse perineal muscles in the superficial pouch, deep transverse in the deep pouch. So, just for understanding, we call them transverse because they are placed in a transverse position. Their anatomical position in the body is transverse. They are not vertical, they are transverse, so we call them transverse. One set of muscle is deep, one set of muscle is superficial, so we remember the names this way. Then external urethral sphincter, compressor urethrae or ureterovaginal sphincter is also the part of this deep perineal pouch. Proximal part of urethra and dorsal nerve and vessels of the clitoris. These are further the contents of the deep perineal pouch. Now, I want one of you to read this slide and tell me what is written here. Yes, doctors. Who will volunteer and read this slide for us? Because actually we are done with the most difficult part of the perineum, and we might quickly finish the session because the rest is very easy and you have the notes with you and you can read and memorize again and again. Okay, no one is volunteering, so I'm reading this slide. The key difference between male and female perineal pouches. So the superficial pouch in female, it has greater vestibular glands, but in the male we have bulb of the penis. And in the deep perineal pouch, guys, the male contains the bulbourethral glands. Okay, so this is also exam question. This is also exam question. These two are exam questions. Many times these are repeated that bulbourethral gland is present where? So you will say deep perineal pouch. And then they say greater vestibular gland or Bartholin gland is the anatomical location is where? Then you will say superficial. So don't confuse between these two. Okay? Don't confuse between these two. I would say this is best table because it's giving you the origin and insertion and innervation. So this is your task to study the bulbospongiosis, cavernosus, and superficial transverse perineal muscles, and then the deep muscles. This way, so that you have a very strong idea about everything about these muscles. And the more you study, higher the chances that you don't make mistakes in the exam. Again, smartly. Study, but Save your time and study in a smart way. This is the bulbospongiosus muscle, this one, okay, on the both sides. This is the scopovernosus, you can see, and these two are the transverse muscle. Where is the perineal body, guys? Where is the perineal body? Yes, perineal body in the center. Very good. It's very easy. Even if you don't have a labeling on the picture, you can easily decide that it's the central part of the both of the triangles. See, you can easily draw the triangles. You can imagine the triangles. And this is the line where the skill tuberosities are giving you this imaginary line between these two parts of the perineum. So this is the perineal body. And tell me another thing. Is this structure, the perineal body, giving attachment to this muscle, ischiocavenosus muscle? Say yes or no. Because you can see the transverse muscles are coming and uh, taking the attachment. Bulbospongiosis is coming and taking the attachment. Here we have levator and eye. Some fibers are going. External anal sphincter, they are going and taking the attachment. What about ischiocavernosus? Very good, Dr. Sahar. There is an exam question in which they give you 5 options. This one, this one, this one, this one, and fifth option is ischiocavernosus. And what is their question? They ask, which structure has no attachment with perineal body? So if you keep this picture in your mind and they repeat that question in the exam, you can easily solve. How many questions you can easily mark incorrect in the exam? Do you have an idea? How many? Yes, Dr. Sadia, you will attend the exam. And what is your plan? How many questions you will mark incorrect? Or you will enter the answer without thinking? Dr. Sahar Bushra, you are taking January exam. What is your planning? Reveal your planning to me so that I can guide you in this. Like you have 200 questions and you are sitting in front of books and you are thinking that, okay, I can make 30 mistakes. None? Is this possible? Is this humanly possible to make no mistakes in the exam? Actually, guys, this is the highest goal you are going to achieve. And when you plan for something biggest, then you know you are able to get passing marks, I will say. But in this, don't worry, Dr. Sadia, we have got you covered. Everything in the anatomy which is important, I'm providing in the notes, and then we have live sessions also. We have discussions in the group. So you will clearly have this idea that how they are asking the questions in the exam, and then you will pass. Don't worry. Yes, anatomy is weak for everyone. Anatomy is actually something which demands repeated revisions, multiple revisions. So if you do that, you can easily solve the question in the exam. But I'm saying that whole paper is very important. You will struggle for all 200 questions. You will struggle for whole 200 questions. It's very unlikely that you get 200 out of 200 or 100% marks in the exam. It's very unlikely. Recently, we have got a student who prepared with me and he got, 93% marks. So 93 is the biggest number I have seen in my life for MRCOG 1, and I was very much astonished, and I told him that what you ate before exam, because this is amazing. This is an amazing score for anybody attending the exam with, uh, post-graduation exam with the responsibilities and the kids. So target should be this. Okay, doctor? Target should be that you will solve all 200 questions correctly. You will enter answers, all of the 200 questions, you will enter correct answers. You will not think that I will mark 20 incorrect or I don't study for this topic, and if they ask, 20 questions from physiology, I'm not studying the physiology. So still I will be able to pass the exam. Don't do that. This is not how they calculate your score. Yes, 93. Yes, 93. Percentage of passing is around 69%. In the last exam, it was 69, 68 to 69. Yes, passing percentage. And it keeps varying. It's not same in all exams. So we can't say that they will pass you at the 70% and they will fail you at the 60%. So effort should be for all 200 questions, okay? So we learned that ischiocavernosus has no attachment on the perineal body and other muscles have. Exactly, चाहते ना चाहते हुए भी हो जाते हैं, Dr. Ash. So that's why I'm saying that if you aim for all 100 questions correct, then 20 will be your luck. And if you aim that, okay, I will go for 80% only, then if unfortunately you have a difficult exam and you fall at 50, then you will fail the exam. So I'm saying that struggle for getting 100%. Struggle for getting 100%. Again, I'm revising this point because this is very important, that pelvic diaphragm and urogenital diaphragm, these two are different structures. So pelvic diaphragm, again, we are revising. Very colorful, very nice picture. You have coccygeus in the purple. You have levator in eye, three parts. Red one is puborectalis around the rectum. Pubococcygeus in the green, and then we have ileococcygeus. Which muscle has the main bulk from levator ani, or which muscle is making up the main bulk of the pelvic diaphragm? And other past paper question. Who will answer? Exactly, it was the purpose of conducting this session, and I wanted you to consider that it's not something that will take hours, and it's not something that's very difficult and you can't understand it at all. Yes, Dr. Bushra, answer is correct. Dr. Sana, very good. And Dr. Sophia is correcting herself. No, Dr. Seher, it's pubococcygeus. Pubococcygeus is making up the main bulk of the levator ani, or else you can say pelvic diaphragm. Now we have to talk about the posterior triangle, which we also call anal triangle. So firstly, we have to learn about the contents of the anal triangle. This anal canal, I will show you the picture. Then external anal sphincter, ischial fossa on the either side of the canal, pudendal nerve and internal pudendal vessels which pass through the pudendal Alcock's canal. Pudendal canal has another name, Alcock's canal. I will show you everything in the picture. Located on the lateral wall of the ischoanal fossa. This is the picture. So you can see on the both sides, these yellow ones, these are the ischoanal fossas. Now you can relax yourself because the main and difficult part of the perineum is already done, and this anal triangle, it's very innocent and very little information. So you can see this is the pudendal canal, it's having vessels and the nerve. Now, boundaries of the ischiorectal fossas are very important. Boundaries of the rectal fossas are very important. So here from this picture, because we have to just use one thing, and that's our brain. The picture is in front of us and we will use our brain. So tell me, what is the inferior boundary of the ischiorectal fossa? Here. What is the structure? Just name the structure in the chat box. I'm reading. Yes. Skin and fascia, perineal membrane. Really? Is this perineal membrane? You sit on the perineal membrane. Perineal membrane is the most outside layer of the body. Look at this, Dr. Bushra, this one. No, guys, we're not talking about anything. This is skin, exactly. This is skin. This is the most outside layer of the body. And that's the inferior layer. And you can see in this picture. Okay, we're going on the lateral side now. What is on the lateral side? This is the structure we're talking about. This yellow one. This yellow one. This is scurectal fossa. So they ask the boundaries of obturator internus muscle, and sometimes, yes, Dr. Sana, sometimes they give you in the option that obturator internus muscle fascia, and that's also a correct answer. And what is the superior boundary? It's in front of you, guys. It's in front of you. Levator ani muscle, very good. And what is on the medial side? Yes, what is on the medial side? We're done with the perineal muscles. Dr. Sana, we have left the perineal muscles in the urogenital triangle. This is a different triangle with different stories. What is this structure? This. This is anal canal, right? If this is anal canal in the middle, then what it could be? Anal sphincter, very good. This is anal sphincter and it's on the medial side of the spherical fossa. So after looking this picture, guys, you can easily confirm the boundaries. And lateral boundary is, the favorite most question of RCOG. They keep asking this question again and again. And again, I want you to revise because I wasn't happy with the answers. So inferior boundary, we have skin. Just remember, in easy words. Then we will go for the fascia and this and that. And the lateral one is obturator internus muscle. So it can be the fascia of the obturator internus muscle. I have told you. Why obturator internus muscle and no other muscle? What do you feel? Why this is the lateral boundary only? Do you remember something from the pelvic side wall? What is pelvic side wall made of? Yes, pelvic side wall. What is pelvic side wall is made up of? Okay, this is your assignment, guys. You already told me the contents of the pelvic floor, and you said that pelvic floor is made up of levator ani plus coccygeus. Okay, so levator ani is in front of you, and you said that this is the superior boundary of this ischiorrectal fossa. And for the medial, you said it's the sphincter. Why this obturator internus muscle on the side, and what is pelvic side wall is made up of? This is your assignment, and you will tell me in 9 p.m. class that what is pelvic side wall. Let's move ahead. So if you're done with the boundaries, that means obturator foramen is here. Okay, don't go deep in the anatomy of the thigh and the anatomy of the abdomen and everything. We're focusing on the anatomy of the perineum here. So we are reading the spherical fossa now. fossa on either side communicates with each other behind the inner sphenoidal canal, also known as the alcox, is the shape derived from the fascia of the operator internus muscle, and it is found in the lower lateral wall of the spherical fossa. Contains pudendal nerve and internal pudendal vessels. I have told you guys that this P word is P letter is made for the perineum. You can see pudendal vessels. You can see pudendal nerve, perineum. And I don't remember exactly if it is a Latin word or the Greek word, but this pudendal means shame. Okay, this pudendal word means shame. So almost everything in the perineum is always covered in the human body. So it's relatable. Pudendal means shame and it's relatable word. Then if you remember this word this way and you remember this PP formula, P is the letter for the perineum. And if you remember another thing which will save you for the whole life, that pudendal nerve and vessels, they have similar names and their branches also have similar names. So mention the branches of the perineal nerve and automatically you are learning the branches of the pudendal vessels. Is this a branch of the pudendal nerve, this perineal nerve? Yes or no? Please mention the branches. What is the other one? Guys, I'm not the one taking the exam. You are the one taking the exam right after 4 months. And this is very basic information and I have shared this information in the study room as well. The branches of the pudendal nerve, the names are very supply, very important. Pudendal nerve is actually a very important nerve for MRCOG1. Okay, so remember that you have to memorize. You have to memorize. Questions are with you, notes are with you. I'm here for helping. And if you don't memorize, if you don't do the task which is assigned to you, that means you are not justifying. And if you're not prepared for the exam, then you are wasting the time, the energy, and the money. Very good, Oksana. Very good, Sophia. Perineal. Then the nerve to the clitoris and the inferior rectal. These three are the main branches of the pudendal nerve. And for the vessels, we have these three same branches. In perineal artery, artery to the clitoris, and then inferior rectal artery. So if you remember this thing, you can solve all the questions related to these vessels and the nerves. Is this clear? Is this clear? So almost everything in the perineum is supplied by pudendal nerve and the internal pudendal artery. Almost everything. So the blood supply is from the internal pudendal artery. It's the terminal branch of the anterior division of the internal iliac artery. Inferior rectal is supplying the anal canal and the skin of the region. Perineal is supplying the branch with the branches deep and superficial to the perineal membrane, supplying both skin and the muscles in the region. So everything is covered from the internal pudendal vessels. Further, posterior labial branches are for the labia, artery to the bulb of the vestibule, and it's supplying the erectile tissue of the bulb of the vestibule. Deep artery is supplying the corpus cavernosum. Dorsal artery of the clitoris, which supplies the dorsum glands and prepuce of the clitoris. They don't go into much and much better. And then we have this innervation. Again, main innervation is from the pudendal nerve. Inferior rectal nerve is the branch of the pudendal nerve which supplies the external anal sphincter, the lower part of the anal canal, and the perianal skin. This is not perineal skin, it's this perianal skin. and it accompanies the inferior rectal artery. The name is also same. Then we have perineal nerve. Clitoris and ischiocavenosus muscle is supplied by perineal nerve. This is all. This is all from the perineum, and this is all from my side. If you have any questions, you can ask.
मैम एक फुट आप चेक करवा लो हाँ बस खत्म हो गई एक मिनट
Yes,
डॉक्टर
doctors.
साहब की
If everything is clear and the rest you can study from the notes and you can ask the questions in the study room also. So you are good to go with this information. And the recording will be with you. You can play the recording as many times as you want. I will share the link of the recording in the study room. The recording will not be available for other students, so it will be only for the core students. But guys, this is my request that cover the things I provide. Like today is the day for GIT, so you should have covered the GIT before sleeping, and you should solve those 20 or 25 questions. This is a very small task. Trust me, if you don't cover the task and if you don't follow the schedule, then you are piling up a lot of work, and in the end, before the exam, you will be in a difficult situation that how to cover everything. Okay. Okay, students have no questions. I'm happy that you have learned, and inshallah, we will keep organizing these kinds of sessions for your learning. See you guys. Bye bye.